Hey guys, today is February 14th of 2020. Today's update information is coming from the Johns Hopkins dashboard. The total confirmed cases are now 64,418, total deaths 1,491, and total recovered cases is 7,064. So it's been a couple of days, guys, and let me tell you, it's been one heck of a ride here with some of the information that I've picked up. Today's video title, coronavirus, the bigger, uglier picture. This is stuff that a lot of people aren't going to like, but I'm going to discuss it anyway because it needs to be talked about. So the first thing I want to do is paint a little backdrop for you. Imagine that you are a person living in, let's just say, a small apartment. You've had a friend who's been pestering you to hang out for, a week or two or whatever, but your house is just absolutely filthy. And you just haven't had time to clean it or felt like cleaning it or whatever. Your house is a mess. And this person is just persistent. They want to come over and hang out. So you finally give in and you say, okay, tomorrow afternoon, come over after you get out of work. So what do? You run around your house and you clean like a nut. Except for you're not really cleaning, you're pseudo-cleaning. You're shoving things in the closet that don't really belong in there. You're sweeping stuff under the couch or under the rug or whatever just to hide it because you don't have time to actually clean it right before they come. So the next day comes and they show up and you've got your bedroom door shut because you don't want them to see in there. You've got your spare room door shut because you don't want them to see in there. And you've got all the spots that you anticipate them seeing looking clean and everything else, right? Now that we have that backdrop set, let's take a look at this. Up until a couple of days ago, China was refusing help or refusing to allow a team from the WHO and the CDC to come in and help. Okay, they were outright refusing. They did not want anyone coming in. Finally, they agreed that they would allow a team to come in. WHO says, okay, we're going to send a team either the 10th or the 11th. Now, prior to this, maybe just the week before, all these reports and leaks and everything else are coming out that China's burning the bodies and all this other stuff, we had the mortuary guy that was interviewed, the crematory guy. He's being interviewed and they're talking about how they're going through so many more body bags. It's 4 to 5 times more than usual. And that's just one little crematory. Data from windy.com shows massive release of sulfur dioxide gas from the outskirts of Wuhan. And this is commonly associated with the burning of organic matter. Now, can we prove it was bodies? No. They were culling chickens because of an avian flu thing like a week ago and everything else. And, there's issues there. But it's still, it goes with what's being said. So we have that. We have a billionaire Chinese person living in exile here in the United States, which is also the same article here talking about him. I'm probably going to butcher his name, Gu Wengui. I'm not sure if that's right, but he's saying that there's a cover-up and that there's 1.5 million Chinese infected and 50,000 dead. That's a lot of dead bodies to get rid of and to cremate. So when we look at this and then we look at the WHO coming in right after, one has to question, was China cleaning up an area where they were going to let this team go? So that it would be all neat and tidy and that would be the area they'd be allowed to go to and that's it? Who knows? So anyway, WHO arrives in China on the 10th, which was Monday. And prior to this, the WHO wasn't really talking, they were not super concerned about it spreading in other places. It wasn't really an issue. They didn't think there was going to be other outbreaks and it was kind of just downplayed. The very next day after they went into China and sent their team in, all of a sudden now the WHO is backpedaling and it's a very grave threat for the rest of the world. Coronavirus outbreak published 2 days ago. Very grave threat for the rest of the world, WHO. A day after a team of the World Health Organization medical experts arrived in China to help investigate the deadly coronavirus outbreak, the health agency's director said the virus poses a very grave threat for the rest of the world. So what did they see? Better question yet, what didn't they see. We know China is not cooperating with them because we have other articles here that show us. Here we go today from Reuters. Experts fear China reluctant to accept WHO ground mission. China is dragging its heels in accepting help on the ground from international health specialists, diplomats, and experts, said on Thursday, noting 4 days after the World Health Organization advanced team arrived in Beijing, no details were released on how and when the full mission would deploy. It would have obviously been better if the mission team had arrived without delay. This is the best one. Not only was China very late in inviting international partners to help with the response, but we still only have a skeletal advance team in Beijing and not Hubei province. Lawrence Gostin, professor of global health law at Georgetown Law, told Reuters. Again, they're only letting them in Beijing. They're not letting them into Hubei province where they want to go. They're controlling, what this team sees and where it goes. They are totally controlling it. And that is just, it's a red flag. Now I want to move on to some other stuff that piles on top of all this yet. I did a video maybe a week ago now. It was right before Dr. Li Wenliang, the whistleblower, the ophthalmologist in China, who was arrested and everything. It was right before he died. I did an article. And it talked about him. And it's right here. This is the article. Chinese doctor who tried to warn others about coronavirus. This was before he died. And I focused on this important part where it says, in his Weibo post, he describes how January 10th he started coughing. Next day he had a fever. 2 days later he's in the hospital. 10 days later they declared it an outbreak. He was tested several times and all came back negative. January 30th he tested again. Came back positive. 20 days later after he showed symptoms he came back positive. I brought this up. I mentioned it. I didn't hear anything about it for a couple of days. Well, guess what, people? Now we're seeing reports about the false negatives. The false negatives. Are the coronavirus tests flawed? Stories in several countries suggest people are having up to 6 negative results before finally being diagnosed. There was another article I read that it said that there was 30 to 50%, accuracy rate. Meanwhile, we have people in our country who came in who were suspected cases that they tested once, came up negative, and let them go. Now, if they got sick after that, of course they're not going to think it's the coronavirus because they were already told they don't have it. That's a problem. That's a big problem. They bring up Dr. Lee in this article talking about it. Here's another thing. The largest study of coronavirus patients so far suggests it could take up to 24 days after exposure for symptoms to show. Now, they're saying this is rare. It's rare for it to take 24 days to incubate, but yet it can. But everybody is still sticking with the 14-day quarantines. And you know what? If you put 20 people in quarantine and 2 of them have 24-day incubation periods and you let them all go, that quarantine was basically useless. So that's great. I mean, that's really great. Really great information there. I'm going to bring up another thing. The U.S. military is prepping for coronavirus pandemic. U.S. Northern Command is executing plans to prepare for a potential pandemic of the novel coronavirus, now called COVID-19. According to the Navy and Marine Corps service-wide messages issued this week. An executive order issued by the Joint Staff and approved by Defense Secretary Mark Esper this month directed Northern Command and geographic combatant commanders to initiate pandemic plans, which include ordering commanders to prepare for widespread outbreaks and confining service members with a history of travel to China. The Navy and Marine Corps messages issued Tuesday and Wednesday respectively reference an executive order directing the U.S. Northern Command to implement the Department of Defense Global Campaign Plan for Pandemic Influenza or Infectious Diseases 3551-13. This document serves as the Pentagon's blueprint for planning and prepping for widespread dispersion of influenza and previously unknown diseases. So now, our own military is now finally taking this seriously. However, let's talk a little bit more about who's taking this seriously and who's not. On Twitter, I'd like to point this out. The CDC posted this thing, and this lovely woman here responded. Okay, this was just talking about the naming, but she's been asking, calling people and everything, and there's multiple tweets from her on Twitter. She said, "We recently traveled back from Vietnam and have requested to be tested for COVID-19. My husband has a fever, a cough, aches, and chills, tested negative for flu and strep. They've been turned down. Why is no one helping us? We could be spreading this throughout New York right now." She was with with 5 other people. It was a group of 6 that went to Vietnam. Luckily, there's no breathing problems according to the tweets and the follow-ups and everything else. She's talking about this. Here's the thing. The CDC asked about her travel history, and because she hadn't been to mainland China, they will not test her or her husband or anyone else in their group. Isn't that nice? Isn't that nice? There's more replies and tweets from her. It's just agitating to think that these people want to be tested and aren't being tested. And the reason I say this is Vietnam is now quarantining a rural community of 10,000 people because of the coronavirus. They're quarantining the people for 20 days, and it's because the rural commune of Son Loi in the northern Vietnamese province of Vinh, I am not sure how to say that, and because I think it's going to come out sounding not nice, I'm going to skip it. 27 miles from Hanoi, is home to 11 of the 16 coronavirus cases in Southeast Asian country, including a 3-month-old baby. Now, these people came from Vietnam. Her husband is sick, one of the other people has a cough, and the CDC will not test them because they didn't go to China and they didn't have direct contact with someone who was diagnosed with COVID-19. This is why I'm saying it's painting a very, very ugly picture. So I just want to say one thing. I'm not making any money off of this. I'm not fear-mongering. I'm not using affiliate links to sell stuff. I'm not peddling anything. The only thing I'm peddling is information. And if you don't want it, don't listen. I would recommend at least preparing to be quarantined for at least 14 to 24 days. So make sure you have, enough food and medication to get you through at least a month if you can't leave your home. Because should our government have to quarantine a small rural area or a big town or a huge city, most people aren't prepared. Most people don't have enough medication and enough supplies to go 2 weeks, let alone a month. At least do it. Think of it as an insurance policy. It's better to have it and not need it than to need it and not have it. And guess what? If you buy, 2 weeks worth of extra food, it's not that expensive. But guess what? Even if you don't use it for this and this blows over, which I pray it does, at least if you get laid off of your job or something, that's 2 weeks or a month's worth of food. You don't have to worry about where it's going to come from. It's an insurance policy and it can go for any disaster, any crisis. Take the time, get yourself set up, and you don't have to worry as much. It's not fear-mongering. It's being reasonable and rational. Take the precautions now so you don't have to suffer later. That's all I have to say for today. I hope everyone is healthy and this blows over, and maybe we'll be really lucky and it will stay in China where it originated. But if we're not, this is what we have to look forward to. Keep your heads on a swivel. Thanks for listening.